Your braces are made of little metal squares that have gone on your teeth, as well as a wire that goes around connecting all the teeth together. It's the combination of these two that allows us to move your teeth into the right place. When you have braces, as you can imagine, you can get a lot of food collected around the brace, and that could put the health of the teeth and the gums in danger. You need to be very good with your brushing, and you need to be very careful with what you're eating. In terms of eating, you want to avoid chewing or biting onto anything hard using your front teeth. Things like carrots, apples, or baguettes are best to be cut into small portions and chew them on your back teeth instead. In addition to that, avoid anything chewy or sticky like chewing gum, because there's a danger it may get trapped around the brace, and as it gets around the little squares underneath the wire, there's a danger they may get pulled off, and that would delay your treatment. For brushing, you hold your toothbrush at an angle, and you need to go underneath the brace, going over the gum as well as the tooth, round and round in circles. Now when you're brushing, it's important that you spend a lot of time but gentle force cleaning your teeth. And as you clean, have a look in the mirror each time to make sure there's no food left underneath the wire or underneath the squares or over the gums. On average, on every 3 teeth, you need to spend roughly 15 seconds, so it's useful to have a timer in the bathroom and measure the length of time that you're spending. Do the same thing for all your teeth all the way around to the back. So go round and round in circles underneath the brace, and having a look each time to make sure there's no food left behind. Don't forget to brush the biting surfaces of the teeth and also the inside of the teeth where usually the tongue sits or where the roof of the mouth is. Once you've cleaned with an ordinary toothbrush, it's useful to use what we call an interdental brush to clean into the gaps underneath the wire. The interdental brushes are made by different companies, but what's important is just the thickness at the end of the brush. The thickness should be such that when you clean into the gaps, the bristles touch the tooth as well as the wire and the squares on either side to give it a really good clean. So first of all, you need to bend the tip at right angles, and then secondly, you push it through the gaps, just like so, to clean into the spaces. And you do the same thing all the way around to the back for top and bottom teeth. In addition to these two methods, you also need to floss to maintain the health in the best possible way. The way to floss is slightly different to how you normally do it. You need to thread the floss underneath the wire first, catch it with your other hand, and when you catch it, then you can move it up and down in between the teeth to make sure the gaps are staying nice and clean out of any food. So that was a quick demonstration, but overall also for any patient who has braces, they recommend use of a fluoride mouthwash. So when you go to buy a mouthwash, it's very important you look on the bottle to make sure that the mouthwash you're buying has fluoride inside it. I hope you find this useful. Thanks very much. Enjoy your braces. Although the brace is held in place with a relatively strong glue, occasionally these little squares on the teeth, they come off. If that ever happens, and it is a long way off to your next appointment, or if the brace is causing you trouble, it's best to come back and have it repaired. If there's any sharp areas on the brace, there are ways you can help that. The best way is to use some wax that is made for braces, and it comes in a little box like this. If you take a small portion of that wax and you roll it up using your fingers into a small round shape, and you can use that rounded wax to cover up any sharp areas by pressing down on it gently, and as you press it, it sticks onto the area to make it feel nice and smooth. This wax occasionally can also come off. If that ever happens and you accidentally swallow it, it doesn't do any harm because it's actually made of vegetables. As the teeth move, also there tends to be a bit of ache around the teeth, and that happens 2 to 3 days after the brace is adjusted. So if that ever happens, don't worry too much. What you need to do is that if the pain or the ache is something that's bothering you, just ask someone in the house to give you some painkillers, whatever you normally take for a headache. So whether that's paracetamol, ibuprofen, or anything like that tends to be helpful. I hope this helps with dealing with any emergencies.